Next, I would like to share with you an interview carried out with Joey Kendal Brown. Joey is a local blogger, influencer, and photographer, and I was very charmed by the way in which she came into our patient education events, came with so much energy, passion, enthusiasm, and a desire of wanting to know. Joey wanted to know everything. She wanted to know all about the science, and we are all about the science. She wanted to know the why, she wanted to know the how, she wanted to know the when, and this natural desire and curiosity has led us to where we are today. What really inspires me about Joey also is her natural ability to write so articulately and so clearly, transparently, and openly, and it's raw, about her passion for beauty and wanting to understand the science of it, to demystify things for her audience. And what we're covering today is her version about taking away from Instagram the truth and versus the reality, and what really is out there for consumers in terms of information. What we don't want to do is mislead anybody. We want to create factual, scientific information for everybody to enjoy. And Joey delivers exactly that. She writes very openly also about motherhood and about the changes that she has experienced in her life, and she shares that very openly with her audience. Now, Joey is going through her current skincare regimen here with us, and she's happy to share that with you, and I'd like to thank her for taking that upon herself to really understand why she's having the treatments and the results that she's currently getting. So without any further delay, Joey Kendal Brown, I hope you enjoy this.
Today, I will be talking to the incredible Dr. Sharina Balaratnam, director of the S-Thetics clinic in Beaconsfield, about her journey into facial aesthetics and how it was inspired by her time as a burn surgeon for the NHS. We'll discuss the similarities between the artistry of what can be achieved with facials, skincare, and injectables versus photoshopping images, or as I like to call it, Instagram v reality, and whether treating our skin and preventing aging in the right way can impact our emotional health for the better. Dr. Sharina will also share why it's so important to receive in-house consultations to achieve the best results, as sometimes what you want is not what you need. Dr. Sharina, thank you so much for joining me today. I literally am so excited to be sharing the amazing information that you've been sharing with me over the past couple of months.
Joey, thank you so much for the opportunity to, be a part of this with you. Ever since we've met, we've talked about the opportunity to have this sort of communication together, and I really value the time that you're giving me here today to share some of my insights into my world, my profession. You've taken a very keen interest as well as to wanting to know the raw truth around beauty, and that just goes to show the passion in which you really want to create the best content for your audience. So thank you for the opportunity for me to be able to do that.
So we're going to get straight in today. Like myself, many influencers are offered treatments with little understanding on the procedures themselves, which is why I am so keen for this interview to be able to enlighten my audience, and also to stop younger generations with that copycat style procedure.
Well, if you think about us, we're all individuals, we're all unique. We all come from different genetic backgrounds. We come from different cultural backgrounds. So none of us are ever the same. All of us are completely different in so many ways, from our skin type, our skin quality, from our facial structures, our facial proportions, the way that our muscles and ligaments in our face and our skeletal template, the way that we are actually created is completely different. Then we take into how we beautify ourselves. The way I dress will be different to the way you dress. And then it just comes from personality, from what we desire, what we also perceive as beauty. So when we really get down to the fundamentals of what we're trying to achieve with beauty, there is no one size fits all. There can be a component of somebody coming into my clinic and saying, I want to have the hydrofacial. For example, I've heard all about it. I love it. I want to have it. And you know what? That could be a great starting point as to an interest into self-care, self-health, skin health, and beauty to go on with. But it really boils down to one thing. What do I do? Where do I come in to that person coming to see me? It all boils down to getting a really good understanding why you're here, what are your concerns. Some patients may not know what their concerns even are. They just know they want something to help them feel better and look better about themselves. So our role and our responsibility, my role and my responsibility, is to ensure that we take a great consultation, very detailed, and try and marry together what that individual is looking for, what may be their concerns, marry that together with a treatment plan. So when it comes to potentially your role and that copycatting, I know you don't do that. You're very, very keen and very dynamic and passionate about demystifying and wanting to know the why and the how and the when. And that's really key. I think people are very keen to jump to, I want what she has and she looks like this, I'll have a little bit of hers. And that's well and good, but what you have may not be the right thing for him or her. And the skincare strategy that you are on has been carefully curated and formulated and put together in that time sequence for you. And somebody else may think, hey, Joey's on that regime and it looks fantastic. I'll take that too, and I'll buy exactly the same thing because I want to look like you. But it may not be the right formulations for her. So I always say, really think about, and now is a great time because we have access to education and online and even things that you are sharing with your audience, to really get to understand, what are your motivations? What do you want to achieve? Is it more hydrated skin, more glow, more pore refinement, more skin revitalization? Where does that lead us to? So there is no one size fits all. It has to be very, very hyper personalized, not even personalized anymore. I call it hyper personalization.
I absolutely love that. And for me, as you say, it is so important that we're not just seeing things on Instagram and doing exactly what everyone else is doing. I mean, you can see 1,000 of the same looking girls. You wouldn't even know if they're the same because they're using all of these apps and stuff. And that is where people like yourself hold such an important role on these consultations to make sure that everyone is getting the best advice. So thank you again for sharing your wisdom with us today.
My
so
pleasure.
we speak a lot about Instagram v reality, and thankfully people are being a lot more honest and open when it comes to admitting to editing and retouching their photos. Is it possible to achieve the same results with non-invasive procedures, and how important is it for us to stop creating a false illusion of the way we look using apps?
I'm going to take this backwards a little bit. I wasn't born into a culture of mobile phones, certainly no Instagram in my teenage years, and things were pretty basic and pretty simple then. So we didn't have the opportunity of, firstly, learning about different tips and tricks of contouring and contouring and how to highlight and illuminate, for example. There was certainly no filters back then. Things have really evolved with the tech and the technologies that we have nowadays. And the other thing to also think about is we did not have that sense of 3D about ourselves as much as we do today. We had a mirror, and that was probably it. And it really was about how you held that mirror that gave you a rough idea how you looked like. And even if you think of cameras back then, you had a single click, you had a reel of 24 or 36 that you sent off to the labs, whereas now you could take 1,000 pictures, you could catch yourself from so many angles by yourself, not even with anybody else in the room. And you're learning so much more about your profiles, your angles, and you're able to identify with things that you like. I always try to say in my consultations, tell me the things you like about yourself first, whether it's your eyes, your nose, your lip. You know, focus on the positives. I think as women, as girls, we spend so much time, you know, berating ourselves down and thinking about the negative, but think about the positives. But that's it. We're spending more time than ever understanding our own beauty. We didn't quite have that maybe 30 years ago. And it's because of that, we've suddenly taken to, actually, I don't quite like this. How can I make this better? And we start pulling at things and, you know, tweaking things ourselves. And we're saying, actually, it looks a little bit better when I do this. And it looks a bit better when I tilt my nose, or it looks a little bit better when I contour and highlight over there. So as a population, we have totally changed. And that will never be the same again. So that's point number one. So then it gets to the point of number two. We're here now. What do we do? So we need to think, how far do we want to go? And there are apps available. There are filters, all of those things that didn't exist before. And look, at the end of the day, I'm not here to critique and criticize,
But I think everything is done for a reason. Some people may want to augment, beautify, amplify, you know, how they look, and each one to his or her own. But I always say the trends are changing. And what I have seen in the virtual world over even the last 2 to 5 years, there's a wealth of information. Sure, you are absolutely right. There are some that take it to a different level, and a whole different level. And I call it cloning, because we're kind of following that copycat you mentioned and say, oh, that looks really great, I'll do that. And you're saying you're putting layer and layer and layer and layer, and all of a sudden you have created this look that one can achieve. And that's an art in itself. You take photography, I love photography too. You can create things, and you can create things with paint. But at the end of the spectrum, what I am seeing are a huge genre of population, very similar to yourselves, and wanting a more natural finish, a much more refined finish even, just that whole less is more, which is very much me. And also thinking about the health. So I'm seeing a whole new paradigm shift in wanting to look healthier, more beautiful, becoming more healthy all at the same time. And I'm seeing that really come into play. So what we're really trying to do is advocate great skin health, bringing health and wellness into the aesthetic space and really integrating that. So I do feel that there's two ends of the spectrum, and having someone like you that the audience can listen to, you are a great influence, you are a great positive message to your audience on health. I mean, you've just told me the other day that those beautiful pictures that you took of yourself, you didn't have any makeup on anymore.
That's all thanks to you, though.
Well, you say that. All I did was listen to you. You came to me with very clear ideas of what you wanted. You had a really clear idea of what you didn't want as well, which is really important. And all I did was listen to what your concerns were, marry them together with that imaging system, the VISIA skin analysis, and we put together the plan that was for you, because you had a goal. And I said, okay, this is what we need to do to get you to your goal. And you went with it. And guess what? You're now wearing less makeup. So I think that's a great message in that as well, is you need to be open to what you are looking for. And when you find the right treatment, the right approach, which worked for you, and you put it through its time as well. So you gave us the gift of time, and that's precious, because every skin cycle has a time, and it's working for you. So that's great.
It's all amazing, really, because I didn't even know anything about a skin cycle. And for me to come to you, I've been offered all these kind of things before, and you actually educated me. And as you say, you gave me a bespoke treatment plan. And now I feel confident enough not to look at my photos and think, oh, I need to remove that, I need to do that, I should look thinner here. I actually feel confident in myself, and I'm going out and about. And the one thing I always said before having a child was, I don't want to be that mum that goes out of the house without any makeup. And you have given me the opportunity to go out of the house without any makeup and actually feel better than when I did wear makeup.
Let's make some new rules. Let's break them.
Yes.
let's turn this into a cup. But you know, honestly, and you're living proof that it is possible. And I do strongly believe in that law of attraction. You know, anything is possible as long as you put your mind to it. 10 years ago, my mom is a huge mountaineer, and she said, you know, I said, it'd be great to climb a mountain with you. So guess what? I trained and I did it. So I do believe if you put your mind to anything, anything is possible. And very similar to your skin, when you said, oh, I really don't want to have to wear all this makeup anymore. And guess what? You mentioned earlier also that you felt your skin was gray at the time. That is just a layer of dead skin. But you may not have known that. You may not have understood or appreciated that there is this thin layer of what we call dead stratum corneum. It's naturally there because we produce dead skin every day. If you walk out into your garden and you have a look at some of the older trees, the more mature trees, and you can actually see some of the bark shedding off. So that is a natural exfoliation of the bark anyway. It's going to shed, and there is clean new bark underneath waiting to come through. So we are all creatures of cycles. Everything is going fast forward, and some of these things slow down with time as well. That's just a normal concept of aging. So when things slow down, you're still very young, so you're not slowing down yet. We need to identify, where is it slowing down? How is it slowing down? What are the factors that are making it accelerate in its aging? because I don't believe in anti-aging. I believe in basically taking the signs of accelerated aging and identifying those. So I call them triggers. And when we take a good consultation, we can identify with patients' triggers. Let's take, for example, pregnancy. It's a good trigger. It's a natural trigger. We all go through that. But it is a trigger nonetheless. Take, for example, other triggers. So let's say bereavement, end of the spectrum. That is what I call a negative stress, big negative stress. And it gives rise to stress. I call stress good stress sometimes. We all need a bit of good stress in our lives. It wakes us up in the morning, it keeps us going. But if you have a chronic long exposure of negative stress, it can be very, very, it can have a very high impact on the aging process. And it causes inflammation. Inflammation in small bursts, fine. I'm all for small inflammatory bursts. We do that in our laser treatments at the clinic. We're creating short bursts of inflammation by controlled burn on the skin safely to create a natural healing process to give you a better result. However, if you take chronic stress, long drawn out exposures and chronic inflammation, then you're going to have a problem. You're going to get signs of accelerated aging, not just in the skin, but in the soft tissue, the ligaments, and you're going to get skeletal aging. So that's why I say it's a three-dimensional approach, because chronic inflammation of the skin, soft tissues, and bone and muscle due to stress is very high impact to the aging process. So coming back to your point about where you are now with your aging, you're aging beautifully, you're aging normally, but it's the identification of the triggers. And you mentioned pregnancy being one of them. But with other patients, we need to identify the triggers. So the consultation process is really key. I just cannot do a consultation in 5 or 10 minutes. And sometimes when I get patients coming in with their friends, they say, hey, do you want to see my friend too? Just 5 minutes. I can do that, but it really wouldn't be comprehensive, and you won't get the best out of me.
Yes, well, I mean, firsthand, I've seen that all of the information that you give in those first kind of weeks and building a plan together is what's so important about the end result. So we see so much trend setting in the beauty industry, but having learned firsthand, we've actually spoken about this a little bit earlier, that walking into a practice and requesting something, in my case, it was actually diamond dermabrasion. I know I told you about it when I first came to see you, and I didn't have any guidance from the clinic that I went to see. It was one of those Harley Street practices that you believe because it's on Harley Street that you're going to get the right results that you want. And yet 6 months later, I had actually worse acne because I was in a state of not fixing the problem before I targeted the end kind of result. How can you as a practitioner give the best advice and stop people from just going in and saying, I want this?
God, you've got some great questions. I really like these, but very, very, very real. Okay, so let me give you an example. My clinic, and we have a number of patients who I will segment our patient population. A vast number of our patients will come in saying, I'm booking in because I'd really like you to tell me how you can help me for reasons 1, 2, and 3. And that's great. We can have an open conversation, an open dialogue, marry the motivations for treatment together with the VISIA skin analysis and come up with a treatment plan. That treatment plan could be time-based, or it could be something that is done to hit a target, meet a goal, and then continue for a very long time. And I like seeing that longevity, because that's when you're really addressing skin health for life. Flip to the other end of the spectrum, and we do have a great cohort of patients that come to us because maybe they are celebrating a 40th birthday, maybe they're getting married, maybe they've just come with a partner. We're getting lots of couples coming together, couple goals, I'm all for that. And they're coming in saying, I'm coming in for a hydrofacial, for example. And guess what? They are booked in, we're good to go. We're very fortunate in the clinic. We have treatment, we have a number of different treatments available, and that has only happened slowly with time as we've evolved in the clinic. We had a much more concentrated treatment portfolio 5 years ago, but we've had to evolve our treatment portfolio based on what we were seeing over the years. And what I saw over the years was someone like what you mentioned, coming to the clinic requesting this diamond type dermabrasion. And in our case, it was something like a hydrofacial. And someone was coming in with very irritated, very angry skin, very red, very inflamed, I would say rosacea with severely disrupted skin barriers. And when that person comes in and you understand their history, there's been a long trigger, whether it's been stress, There's been a lot of pollution because they're living in central London. And I want to mention that fact because this is one thing I've identified in the last 5 years. Pollution in London had been getting a lot worse over the years, and our patients were coming in with highly inflamed skin, some of them, not all of them. And we weren't able to carry out the hydrofacial because their skin was too raw. So in that classic example, if we had just gone ahead and done that blindly without thinking about the safety of that patient, it would have been fine. The recovery might have been a bit slow. Then we're not doing the right treatment for that patient. So again, it's understanding the history, finding out where somebody lives, finding out what they do in their occupation. And the other thing also to find out is what is somebody currently using in their skincare. Again, 30 years ago, I didn't have the access to the wealth and breadth of skincare that is out there. You can buy it on the internet. And a retinol might be good for some, but a strong retinol may not be good for others. A lot of patients are coming in doing too many at-home treatments, too many mild peels, too much salicylic, too much everything. By the time they come to us, they're inflamed. So coming back to your point, that treatment may not be right for them. So what did I have to do? We had to think of other things. We have the oxygen facial. Let's go backwards in time, similar to how we approached you. Let's do operation cleanup. Let's heal the skin. Let's reduce the inflammation. Let's manage the oil control. Let's remove the dead skin safely without being too aggressive. Let's get the oxygenation of the skin boosted again. And we do that by, manual lymphatic drainage therapy because it sheds the old toxins and brings the oxygen back up into the skin. Let's get it cycling again. And guess what? When you actually focus on the past first, when you're in the present, then when you go into the future with the rest of the treatment plans, you get the best result.
And I think actually you end up with possibly a better result listening to your guidance rather than just going in and saying exactly what you want. So I just love that we can share this with everyone today.
Joey, may I add one thing to that as well?
Yes.
I often get asked, well, it's well and good. You're saying I need to fix the past and repair all of that. And I get what you're saying. And I often get asked, well, how much time is that going to take?
Mm-hmm.
How much do I need to invest in that whole scenario? Because that's well and good, but I don't have endless amounts of time. I don't have this, that. But I always say, if you're wearing a good quality regimen, it doesn't have to cost that much. You need to find the right ingredients. That's really important. Rather than being a pick and mix and using the wrong things, you need to have a strategy. Then if you think of the skin cycles, you're young. So your skin cycle would be going every 4 weeks, for example. Once we get a little bit older, we're chugging away maybe every 6 weeks. So it takes a little bit longer. But as you say, you saw your results in well under 6 weeks. That's actually very fast in the grand scheme of things. Whereas if you'd come in and we'd carried out something like a microneedling or something a bit more invasive, you wouldn't have been ready. So your recovery would have actually sent you backwards.
I think that's something that a lot of clients don't understand. And they think that by coming to see someone and asking for something like the diamond dermabrasion, you're going to get immediate results with no active scarring, but it's just not true. And by you sharing all of your insights and education, it's more than just a process of having a treatment, it's an understanding as well.
I feel you get more longevity out of it and you get a better quality result and you get something that's just a little bit more, you get that life back into the skin. And I love going back onto the past because there is a lot that we can clean up and we can optimize and refine in preparation for the next thing. So I like to use the analogy of I would like to grow a plant, let's say, and I've got 2 back gardens to choose from. I've got the back garden of someone who has lived in this house and looked after their back garden for years, and it's flourishing and they've moved out. So there's option number 1, back garden. Option number 2, back garden, is someone who's had a nice house, but they have done nothing to their garden over the years. And the house is nice, but the garden's okay. If you have the choice of the 2 plants where you're going to literally just plant them, and you want them to grow to their best, guess which one it's going to grow in? It's going to grow in the garden that's been nurtured by the lady or the man who lived there, who's been looking after the plants, who's been putting the right soil, the garden has been coming in. There's been a lot more TLC over the last 1, 2, and 5 or 10 years, whereas the garden on the right is dry, is dehydrated. There's been no love, there's been no TLC, there's been no oxygen coming through the soil, there's been no worms and, you know, all the creatures underneath that help the garden grow. So that's when collagen production comes in, and I use that same analogy. So with collagen production, whether it's with techniques like laser, microneedling, whether it's other technologies, radio frequency, we do a lot of that. I always say, think of that analogy. We need to plant a seed and we need it to grow for you. That's the result. So we need to optimize the soil, which is your skin, feed it, water it, love it with the right ingredients, and then it can grow.
It all makes sense, doesn't it? Do you think using things like aesthetic treatments over image editing, we can actually improve our mental health in the same process?
That's a really good point. I want to mention a couple of other things before I get to the aesthetic. For me, it's really important to identify with the patient, with all of our patients. So whether it's me or our team, it's why someone really is coming into the clinic. Now, one end of the spectrum is body dysmorphia. And I think it's really important to touch on that. Patients should come to the clinic because they want to look and feel better about themselves in a healthy way, very positive way. This happens very rarely, but once in a while, we do identify someone with an element of body dysmorphia. Someone who's maybe obsessing too much about their beauty, too much about a certain feature, too much about just everything. And if somebody presents with maybe taking too many pictures of themselves, I want to look like Kim Kardashian, I want to look like Kate Moss, you know, we see much less of that nowadays. I have to say, you know, there's been a total shift. But once in a while, this may arise. And it's really important for us to identify as doctors and practitioners how we can help that patient in a different direction. How can we address and say, well, these are your normal anatomical proportions. These are very normal for you. And if someone is requesting something that I personally feel is not required for that person, then we have a very anatomical, a very scientific, a very straightforward question and answer session together. And I help them identify all the points of beauty. So I want to mention that because I think it's really important for their audience, for your audience, to identify there are patients out there with an element of body dysmorphia. And I think we need to be sending the right messages, the right things, and even identifying with who is giving the wrong messages out there of perfection, of idealization. And it's hard. I think it must be very hard as a teenager nowadays, when we all have our own insecurities as a teenager to grow up with, to see these visions of perfection and illumination and think, oh my goodness, I need to look just like that. We need to be very careful. So I just want to compliment you on the messages that you are giving to your audience, because it's very important to know that there are girls and boys out there that will be vulnerably informed, and we have to set the right tone and responsibility. But at the end of the spectrum, in answer to your questions, are there injectables to make people feel better? I have a number of patients that come because they're either frowning all the time or raising their eyebrows all the time. And that can send, although these patients are very fit, they're very well, they're really positive and energetic, too much frowning in a negative way, it retrains the muscle to behave that way. And guess what? I have patients coming up saying, please help me with this, because my kid is asking me all the time, why do you look so cross at me all the time? I'm really happy. There's nothing wrong with my life. So that's when a muscle has become overtrained just over the years. My patients have had 4 kids. It's just settled in. So guess what? We can use a neurotoxin. That's called botulinum toxin. One of the brands that I use is called Botox. That's produced by a global pharmaceutical company called Allergan. And we can use a neuromodulator, for example, in the glabella, which is the frown. And we generally use maybe 5, sometimes 7 injections, but generally 5. And we can diminish the activity of that overactive muscle. So the muscle is overactive. It's not normal. It's been bodybuilding for years during the childhood, and it's been bodybuilding, and guess what? It's overdeveloped and it's overcontracting. So when we can reduce that using a chemical modulator, then the patient is now saying, hey, I'm looking less negative. So it does give an element of reduction in negativity, because if you can't frown, guess what? You're naturally going to be more positive. And there are clinical studies that have been published that actually prove that. So that is one example. Another example can be having another treatment. So let's just say a facial treatment. You've had one of those in the clinic.
Yeah.
And you've had it the aesthetics way, where we've married together our lymphatic drainage, and we also have extremely skilled practitioners that really understand the human touch as well. So for us, it's beyond just having the treatment. It's really about the touch, the lymphatic, the flow. And when we release oxytocin in our nervous system into our bodies due to touch, due to bonding, it makes us feel a certain way as well as the blood flow and the lymphatics. So I don't know about you, but I have my own treatments in the clinic. I have with my practitioners, and great. I like the way I feel. I love the way I feel when I finish. But that's also the oxytocin release. Oxytocin, as you know, we produce that during breastfeeding. We produce that during uterine contractions when we have our kids. And that is a strong bonding hormone as well. So right now, even in self-isolation, I always say, take some time, take more time, because you've got that now. And when you spend more time of care and preparation of your skin, of your regime, we do release a little bit more oxytocin into our system without even realizing. And that also reduces stress. It helps boost the immunity. And all of this is really important for us in this time of self-isolation.
I think it's fascinating, actually. There's so much science behind the aesthetics as well. And actually, even hearing you talk today, I'm learning even more than we have done over the past few months.
Good.
So as a practitioner, do you feel a moral obligation to nurture your patients rather than submit them to fast fixes?
Absolutely. When we graduated from medical school, I graduated 22 years this August. It's gone so fast. We take a Hippocratic oath. That's something we do as a conglomerate when we graduate as a group. And you take that Hippocratic oath to first do no harm. That's really important. And you need to look after your patients, look after your colleagues as well. Treat with respect, dignity, integrity, professionalism, all of that. So that is something that we are sworn into. And to be fair, I guess I swore into that a long time ago when I grew up in Malaysia with my mom and dad. And they are still back home. They have a clinic of their own. My father is a neurologist. My mother is a nurse. So I guess when I grew up in their clinic from the age of 7 and over, I would sit in, one of their chairs outside of the consulting room, but I would watch together with their team patients coming out. And these were patients who were sick. They were stroke victims, or they'd been through road traffic accidents and they were having neurological problems. But I was watching the hope that people went into the consulting room with. And that's the big word. It was hope. How can you help me? How can you heal me? How can I get better? Sure, I'm probably taking this to the one end of a very big spectrum in medicine, but I was left just seeing that hope. And over a period of time, now it's been many years since my father had his clinic, my mom too, and to watch and know that he still sees so many of the same patients. They're all healing better. They're still performing better in their lives. And that's where the inspiration really came from, in order to heal, to be able to help somebody with hope and to see it for the long term. My parents still practice. My father still has his clinic back in Malaysia, and that is for the long term. So it's never about the quick fix. It's always for the long term. Let's flip to my clinic now, S-Thetics. It's not a 40-year-old clinic. I hope I'm here for that long here in Beaconsfield. We're 5 years old. So when we started, we had no patients. There was nobody. And all I had to think about was, I know I want to practice medicine. I know I want to practice aesthetic medicine. So who is it that's going to come and see me? So that was my hope. And patients came to see me with their own hopes, with their own motivations. And it was down to me to actually say, okay, what are your concerns? Most of the time they were anatomical concerns. And I would say, okay, point out 3. And let me give you an example. It would be something like this. And I don't like this. And next, oh, I don't like this. And I'll say, okay, what would you like to look like? And everyone would go, this. And I'll say, okay, so at least we're starting a position. And I'll say, okay, let's take it beyond the anatomy. And anatomy is really important. Look, we've all got flaws and bits that we'd like to correct and optimize. But how do you feel? Do you connect with any feeling? How do you feel about your aging? How do you feel about how you look right now? And I would produce a chart, and it's got 6 what we call emotional attributes. And this is the number one thing that our patients present with. wanting to look less tired.
Mm-hmm.
Look less tired. And some patients could be tired, in which case that's a different conversation, but most patients could be tired due to anatomical aspects of aging. So when you lose a little bit of temple volume, let's say, that could make the eye look tired or negative. So some patients may say, actually, I don't want to look quite so sad anymore. When we lose a little bit of cheek volume, for example, some patients would say, I look really angry all the time and it's freaking my kid out. You know, they're saying, why does mom look so angry all the time? And then at the end of the spectrum, we have a large number of patients who are 70 to 79, for example. This is a lot of my population. And they will say, I don't want to look quite so saggy, or I want to look more feminine, I want to look more youthful, whichever. I find that more patients now don't use the word I want to look younger. They just want to look as good as they can for their age, as healthy as they can, positive aging, dynamic. So you really then connect on a deeper level that it's not about the quick fix. Sure, we have treatments that can give you a fast fix, things like the fire and ice facial, the hydrofacial, the Endymed radiofrequency skin tightening, these kind of skincare and formulations, medical grade facials, they've come such a long way. So yes, we can give you a quick fix, but then what? We're missing something.
Yeah, it doesn't have the longevity, as you say.
We're missing the long term. So I always take a great pleasure in seeing our patients return. You don't have to, you know, that's just the bottom line. But a lot of our patients come back after 5 years, and being able to show results of 5 years worth of VISIA skin analysis. And guess what? Our patients are actually looking younger, more healthy, more hydrated, more luminous. And we have corrected and reversed some of the signs of aging that they had shown. It's incredibly powerful.
I know firsthand that it's definitely working for me and actually making me feel better in myself as well. But for the cynical patient, how can we track the progress of a treatment plan, for example, and how can we make them understand that it's not just, for example, because I was pregnant, I had less time, I was more tired, I was dehydrated and not looking after myself. And now I've started on this treatment plan that obviously is fixing all of these areas that need to be fixed. But what can we do to make people believe that it's not just someone with great marketing skills telling you this is what you should do? For example, like influencers, how can you as a practitioner explain that to them and get them to believe that it's the best practice for them?
Well, look, you know, I have a great imaging tool in my practice. I share the same passion as you. I love photography, and I've taken photographs all my life, and I enjoy my digital camera. So I like tech. I like a lot of tech. And here in the clinic from day one of the first bits of technology that I purchased was the VISIA skin imaging. Why did I do that? Number one, to help patients understand and to learn why you are aging, what are the signs, and with that, they're identifying with their own learning and their own aging processes. Then we can marry it together with the consultation, and we can say, okay, if these are the key things that you can see on the surface of the skin, the VISIA now takes it subsurface. So you're going underneath the skin where all the building blocks are. And we're not making up aging. Aging is scientifically proven. We actually have understood aging of the skeletal template because we have CT and MRI scans that have been carried out in our work showing how the skeletal template actually ages. And it happens in a fairly strategic fashion, which is important for somebody like me to understand when I'm carrying out facial injectables, because I carry it out in a layered approach and I'm continuously thinking about skeletal aging. So if I have someone presenting at 20, 30 or 40 or 50, I'll have to fast forward the plan to think, how is that person going to age predictably? And then I need to start planning my treatment sequence. So that is called the aging trigger point when I carry out my facial injectable strategy. Let's go to the end of the spectrum, the skin. So by looking at the underside of the skin, if you're doing great, fantastic. Let's just optimize with a great cleanser, some great antioxidants like vitamin C, fantastic hyaluronic acid, and a fantastic SPF. Prevention is key. Make the most of the youth, make the most of what you have, and don't let it go away too quickly. But I love the fact that you can educate someone on how you're going to age, how you're going to anticipate. We can almost crystal ball it if you think about it. And prevention is better than cure. And now you have access to the right treatments, technologies, topical formulations. So it is much easier than it was 5, 10, 15, 20 years ago. And then are we making it up? We don't make up the aging process. It is scientific. So if we can predict these cellular changes, and we can then, very similar to you, put someone through a treatment strategy. And for me, it's about the evidence. I come from a surgical background. So yes, I too am also cynical. So I welcome everyone into the clinic that is cynical, because it's a great opportunity to learn. You came into my world at one of our events at Head Soul House last year, and you saw for yourself how scientific that concept of aesthetic medicine, how it came into the world of beauty and wellness. And it is what we call evidence-based. It's clinical evidence. There are scientific publications and there are peer-reviewed journals. And sure, whilst your audience may not need that level of detail, it's all there. The VISIA allows me to do that, and I can actually show changes every skin cycle, 6 weeks, 12 weeks, 18 weeks, 1 year later. And we see those results across the board, whether you're 18 or whether you're 79. We show patients their results. And yes, even our 79-year-old patients get fantastic results. Begin anywhere. That's really key. If you look at the end of the spectrum, look at the world of bodybuilding, for example, and you have patients that are, you know, maybe it's not just weightlifting. You need to feed the soul. You need to feed the muscles with the right proteins, with the right amino acids, you know, the right level of carbohydrate. You need to have a strategy. You can't just have 6 weeks of weight training. You're not going to get to that athletic physique like what you hope for. And then you need to measure. Photography is key for measuring physique. We also have a new imaging system called the Vectra, which is, again, from Canfield, the same family as the VISIA. And the Vectra imaging is now 3D. It takes a 3D image of your face and your structural contoural changes. And we can then identify how that's going to predict in its aging process. We can do the same with the body as well. And then we can show patients their results. And very similar to so many other things. All these things are very accurately measurable now. And we go very, very technical into that with our patients. And they love it.
For me, I was blown away by the first imaging versus the second imaging 6 weeks later on the VISIA machine, because the redness that I wasn't aware of, because I was obviously uneducated in that kind of area, that was a dramatic change. And then seeing my new skin age, having had a treatment plan, versus me thinking, oh, I saw that person say this was a good product and that person say this was a good product, not getting any sort of results and thinking, am I wasting my time using a whole process? So it was amazing to see that everything you'd said to me, I'd come in and said, believe in these products, go and use them. And I came back and I saw the results for myself. And you can't deny that on the VISIA, can you? Because it's there and it's showing you the percentages in the improvement as well. And also the before and afters, and also where you could lead to be, as you were saying earlier.
It's also the knowledge now. Look, 5 years ago, as I said, we didn't have any patients, and I had my own hope. I had confidence. I had confidence in what I knew. I had confidence in what my hands could do. And what I had was no patience. So it was having the confidence to say, this is what I'm capable of delivering to you. I know what's in the skincare. I know what it should do. So now we need to put it into practice. So the only way I could measure the success of our results, I'm going 5 years ago, was with the VISIA. I'll say, come back. Let's see you in 2 weeks, because if you're young like you, then 2 weeks is half a skin cycle. Let's check out what a half skin cycle could do like. And I want to thank all of our patients for that first 2 years in my practice, because they were wonderful. They wanted to learn as well. So they'll be like, sure, I'll come back in 2 weeks. And they came back in 2 weeks, and we sit in that dark room just like how we did. And we would measure and say, hey, this is working well. But then sometimes you need to fine tune, right? Because not everybody is the same. Everyone's very unique. And sometimes they'll say, hey, actually, that's done well, but maybe we can change it up and do it differently. So we would tweak and optimize the settings. And then I would measure them in 4 weeks, in 6 weeks, in 12 weeks, 18 weeks, and 1 year. And guess what? When you do that after 2 years, you learn so much as a clinician. And our patients value the fact that we have tweaked and changed things, because sometimes it goes well 99%, 1% you can optimize. And we have learned so much. So let's fast forward 4.5, 5 years now. When you come in, I know what those formulations are capable of doing now across the breadth of skin types that we've seen, and across the breadth of ages. Don't forget, male and female, slightly different as well in terms of the skin phenotype. And I should be able to now, by this point, say to you, if this is what you're presenting and these are what your concerns are, this is what you want to get to, let's have a look at the VISIA. Let's see what's going on underneath the skin. And if you use these 4 to 6 things, these are the type of results I should be able to hit with you in one skin cycle. That is my predictability for you. Everyone gets a good result. Once in a while, if I don't see the result, I'm getting something's up. Are you using it? Are you using it?
So fast forward and going on with the younger generation, how can we convince people that it's more important to prevent the signs of aging rather than attacking them with damage control?
Because they are blessed. They are blessed with the youth. You've already got it. And also you're blessed with time. The longer that we've been on the earth, on the planet, the more exposed we are to different things. The most important thing that we're exposed to is sun. Now, on a day like this, we don't see that bright blue sky. The bright blue sun gives off UVB rays. Now, UVB rays, you get to see on those bright days. You get to see on holiday when we go to a hot country. B rays bounce off your skin. They give you that golden brown. So just remember, B for brown, they can also burn you. And when they burn you for a long, sustained period of time, that's when you get the skin cancers, and that's not good. So then here on a day like this, dull and gray, Britain, we have UVA rays. Now, A rays are all around us all the time. We can't see it. So the myth is, I'm in England, I don't have any sun, I'm not going to get any problems. But if I'm sat in my conservatory, which is just right there, and if I'm sat there all the time for years, I also have a risk of developing skin cancer because the A rays go through my skin, they come through the glass, they come through the conservatory glass, they go through my clothes, and I have a risk of getting skin cancer. And I know that because it's clinically proven, it's evidence-based, and I spent a lot of time in the NHS in the past in reconstructive skin oncology, which means skin cancer, taking off little skin cancers at the back of all the ladies who had never been away on holiday in their entire lives. And they've been sat in conservatories for 15, 20 years looking after their grandchildren. So it does go through. So it's that kind of knowledge that we need to impart in someone who's younger. And we show them, we educate them with the type of patient education events that we have. We get them to have a VISIA skin analysis. And we say, look, you're on your mobile phones. It's called a smartphone for the reason it's smart, it's educating you. And use that power to actually come into a clinic like myself, take a picture of your skin, learn and understand how you can use great quality skincare. One of the skincare ranges that we have is a botanical base, but it's botanical and it's pharmaceutical grade. So now you're actually using something that has got no synthetic in it. So it's not aggressive. It's going to be safe for your skin because the type of active formulations are much more targeted to the receptors in your skin. So they're going to bind together more in a much more friendly approach without being so aggressive. So I like to take somebody who's younger and really educate, give them the empowerment of that knowledge. Events like Head Sore House are a great opportunity. Having the opportunity to speak with someone like you and to share that knowledge is a wonderful opportunity. And I hope you spread the love. I hope you spread the messages, deliver it so well.
I was that person who was lazy, would be damage control rather than prevention. And now I just feel like I wish I'd known sooner. And obviously I want everyone else to know as well. And I think it's so important that we're getting that message across today. But I know something that I always wonder, and a lot of other people ask as well, we spoke about it briefly earlier, about Botox. You hear a lot of people saying poison. What actually is it used for? Is it safe? And are there any other benefits from it as well?
Oh my goodness. Should we have another webinar on this? I love this topic. Let's have another webinar. Okay, you're talking about things that I can talk about for hours. Let me share with you the first time I ever administered botulinum toxin. It was in 2001 in a hospital in Warwick, and I was working with my professor, John Clegg. Now, he was a pediatric orthopedic surgeon. And we were in his surgical theater, all scrubbed up, about to inject an anesthetized young boy of about 9 years old actually. And this was someone with cerebral palsy. So he's all contracted, very tight, the parents unable to hold their young son. And we were using a lot of vials of botulinum toxin injected in very specific muscle groups, just so that when the toxin kicks in, which is what it does with the frown. It relaxes muscles. Those muscles will then relax, and the parents can then hold their child, and the child will then be in a relaxed position rather than being, unfortunately tight and constricted. So that was my first ever experience, 2001, with Professor John Clegg. Thank you, Dr. Clegg. We were treating cerebral palsy.
I mean, that's incredible to hear that you can do that and change someone's life with something like an injectable.
Well, you're changing a parent's life. So I was very annoyed with Professor Clegg's work, and I never thought in 2001 that I'd be doing what I do now in facial aesthetics using the same formulation. And when I really understood what's in that formulation, it is a muscle relaxant, and it's a muscle relaxant that works actively to reduce hypertonic muscles. Hypertonic means they're hypertoned, hypercontracted. So you've got hypertonic, you've got hyperkinetic. Hyperkinetic is someone that's hyper moving their muscles, okay? And sometimes we know that we kind of overdo certain muscle movements or overlook. So you can almost identify with what kind of muscles that we overdo in our facial muscles. And we take that analogy and work on muscle movement. That's what botulinum toxin is there to do. Reduce the movement, not freeze it, not paralyze it. That's when you get the overdone, the overshiny, and that's maybe not my thing, and which is why every patient and practitioner has to have a very clear idea of what the expectation is and what the common goal is. And then a very interesting point to think is, what are the myths behind botulinum toxin? So you just said to me, is it a poison? Is it a rat poison? I hear all these things. It's a great opportunity to be able to explain to patient what it is. Did you know it is a neurotoxin, but it was found in the days of the World War. It actually came from infected sausage meat, and it made the soldiers extremely unwell. So a very clever scientist isolated this protein, and it comes from a bacteria. It's called Clostridium botulinum. And when they think, gosh, I didn't realize it actually came from infected sausage meat. What is that doing on my face? So that's when you need to bridge the gap on the learning, and the story is fantastic. There's actually a couple of oculoplastic eye surgeons in Canada, Jean and Alistair Carruthers. It's still very well known to date for all the scientific research that they have done on botulinum toxin. So they contacted this very clever scientist, and they said, we need something. We need an ingredient to treat our patients, bearing in mind they're eye surgeons, to treat two conditions. Number one was this. Can you see that? Excessively blinking. So the muscles working too quickly. Number two is this, looking cross-eyed, okay? Blepharospasm and strabismus. So those were the two indications. So that's how it all started about. So they worked in diluting this toxin in very small quantities. We're talking fine muscles, injecting into the specific muscle groups. And guess what? Female patients will come back and say, wow, Dr. Carruthers, both of you, thank you so much, because I'm not blinking excessively. There's a stigma attached to that, but I'm also looking straight again. And guess what? Some of my crow's feet lines are starting to go away. So thank you very much in return for the aesthetic benefit. So they were onto something, and they said, wow, we have got now, number one, a medical indication, which is the strabismus and the blepharospasm. So that's really when it came about in the 80s. But then they started to work on all of the scientific discoveries that got the frown line license and approved. That was the first one. And then it got the crow's feet license in 2012. And then we got the forehead license a few years ago. So everything is slowly evolving in the use of aesthetics. So what you do find in the world of my world now, which is non-surgical medicine, facial aesthetics, is that most of the things that we do have come from a medical background or a plastic and reconstructive background, or even an industrial background. If I look at how lasers have evolved over the years, they come from industry and now they've come into our world of facial aesthetics. So when I look at botulinum toxin, it has celebrated that particular brand in particular. 30 years last December is the longest running botulinum toxin. There are other brands as well. And that has been one of the most widely researched drugs on the planet. I think it gets bad press because of the overdone look. That's a shame, because we use it. It still is used for a lot of medical reasons. It is also used in the world of GI, gastrointestinal medicine. It's used in the world of bladder spasm. It's used in cerebral palsy. It's also used in cervical dystonia, you know, the neck twitches. Yeah. And we also use it very commonly in underarm sweating. We use a lot of underarm sweating injections, and that is an easy treatment in the right patient with a excellent result in prognosis as well. So the medical indications are far and wide. I wouldn't be surprised you're going to see a slightly more off-label use become more regulated, because they will develop its licensing in common areas like neck muscles as well. Overzealous neck muscle use, we call them platysmal bands. And off-label, if we use some of those injections very delicately, we can produce beautiful results in relaxation of the muscles. So yes, it's a shame things get bad press, but I think they only get bad press when they're done too much, too far, in the wrong way. Everything done in the right, refined and reformed way produces beautiful results with our patients looking done.
I mean, it's just fascinating, the history and the science behind everything and where everything derives from to then become in an aesthetic world, and us use it for all these different benefits as well. But your last comment actually leads me on to my next question. So in terms of using injectables, where are they most beneficially placed? So we hear the term chasing the lines. How can we avoid that? And I know I've seen your artistry. It's almost like you're photoshopping for real using these injectables, but how can we do it well to make someone look their best self?
The whole evolution of facial fillers has been fascinating. I first came into the world of facial fillers in 2005 actually, when I took some time out to do some research, and that's when I started looking into the world of laser technology. I was doing my master's in laser technology at the time. And because of that, it brought me into the world of aesthetic medicine. And that led me to the world of facial fillers. I knew about them, I'd heard about them, but I certainly hadn't seen them being put into use, put into play. So when we look back at 2005, and that was when I actually attended a course, I thought, this is so interesting. I just want to see what this world is all about, even if I've got nothing to do with it. So I've always been interested in learning. And back then, from an injector. So I want to show you things from my side. Firstly, just so you understand how things have evolved to now. And back then, and this is no critique on the trainers that trained me back then, because the trainers were fantastic, but it was about chasing the line, and it was about filling a fold, because we did not know what these things were capable of delivering. So we weren't taught or trained in that way. And I think if you asked me to deliver a training course 15 years ago, I would have probably done exactly the same, because that was all we knew. So we used to chase a line. It would have been the nose to mouth line called the nasolabial. And we used to fill it up, and we used to go, yay, great result. And we used to then use a similar type of filler. It's a hyaluronic acid. So we know it's naturally formed in our own skin. We're just restoring it back. And we used to, treat the lip area. And we pretty much got trained in similar type ways, very well, but similar type. So you take what we learn, we now are going to treat patients that way. We did a good job. They were fine. The results were good. Patient satisfaction was high. The products were good back then. That was what we knew. Now, when you roll forward 10, 15 years, the amount that we've learned from anatomy. So when I talk about the clinical papers on the anatomy of aging, the anatomy and the fat pads aging, these were clinical papers produced by very clever scientists, anatomists, and those were published from 2007 to beyond sometimes. And we learned so much. Wow, if the facial fat pads are in distinct anatomical compartments divided into superficial and deep, sure, that makes sense, because we're not just one big mass thrown in. We can't just use this filler and put it everywhere. We need to respect the anatomy, and that we need to be thinking about it like building a house. I'm not saying that we are houses, but even with the house, we don't put the cushion or the soft tissue refinement first. We have to go underneath, and we need to put the pylons back in. So that is the deep plane. And then after that, we need to put the walls too. And that is the structure or the contour. So that is the medium depth planes. And then finally, we need to put the roof over our head and start painting. And that's what I call the refinement. So even with fillers now, because we've learned so much about the anatomy of aging, we understand that we need to go foundation, we need to go contour, and we need to go refinement. Does that make sense? Mm-hmm. We also then understand how the products have evolved. And the products have evolved, so there's never just one type of filler. We have a family of fillers, and they come in all different densities and viscosities. So we have to really understand the product pharmacology and understand that we're really looking at things from a layered approach. And then finally, we also think about the patient. And we have to think about someone coming in saying, okay, I'm unhappy about this, Or what is it you globally don't like about your face? Well, I just don't like the fact that everything's doing that. Then we need to really go through the whole aging process and explain to someone with predictability, this is how fast forward in the future this could look. And we need to be able to explain with them. The new concept is now coming about aging trigger points. And that's the whole point that I said to you. We should be able to predict how things are moving here, how things are moving in the cheek, and everything more or less comes down and in. And we need to take everything and make it up and out within reason. So in answer to your question, the trend has really moved away from chasing lines, because if you think about it, if I kept chasing a line for the next 10, 20 years with everything falling down and in, it's going to look wrong. It's going to look very Homer Simpson-like. Whereas if you rebuild from the outside up and using a layered approach, foundation, contour, refinement, you're going to get a much more beautiful result, which is why the skill and the artist who actually just taking somebody back globally a couple of years and making them look ageless rather than making look done.
I think that is an absolute perfect way of describing the difference between someone who's having the wrong procedures from someone who's not educated versus coming to someone like yourself and having it all done and you look natural, and people don't know what you've had done, but they think you look like the best version of yourself.
You need to look like you've just gone and had a great holiday. A really good holiday.
Which we all need after lockdown.
So that's the whole point of fillers, making someone look well rested, more refreshed, less tired, less sad, less negative. So it's about taking the negative emotional attributes and flipping them into a positive emotional attribute. And you can do that. You can do that with fillers. You've seen some of my results. And that has really come, and I'm very privileged to have been educated and exposed, on a global circuit with people and peers and colleagues within my field. We share knowledge and we learn with each other. And, one particular person, that I would mention is our global mentor, Dr. Maurizio De Maio. He is the mentor and he's a lead faculty for the Allegan Medical Institute, which I'm a part of. And this is Dr. De Maio is a plastic and reconstructive surgeon that has dedicated a lot of his time and his life now to understanding how fillers can be placed under the skin to produce natural aging results. And we know now that with the fillers, when we use them under certain muscle groups, we can actually create something called muscle myomodulation. And that's where you take the filler, you put it under a muscle, and you can actually cause the muscle to recontract like how it did many moons ago. So when I use these fillers now, I work on that concept of muscle movement, because one muscle talks to another and another and another. And by using more filler rather than toxin nowadays, you can actually make muscles work to lift the face up. It's fantastic. So taking to a step further, your question is, do you just use fillers for facial aesthetics? We can also use them now for muscle movement due to weakened musculature, muscle paralysis as well. And we can use them under structures to help create a much more symmetrical, slightly more natural smile when someone's going through a tough time medically.
I mean, I just think that it's so amazing the way that you can use all of these different procedures in so many different ways. But as a clinic, the S-Thetics clinic, you offer so much more than just the facial aesthetics. You've recently launched the EMSculpt machine as well. And could you give us a little bit of an insight in what that entails, and is there more benefit to using it rather than just having an aesthetic result at the end?
So EMSculpt is a phenomenal technology. When I started the clinic, we specialized predominantly in skin and face treatments. That's where we started from. And as the clinic evolved, more and more patients started asking me about non-surgical body contouring technologies, ways in which they can refine, tighten, and tone certain areas in their physique. And these generally were patients who were already fit, very well, very healthy, that just wanted a little bit of refinement. One example being post-pregnancy, post-menopause, post-surgical. So I see a lot of patients like that already on a good lifestyle and a good diet, fairly healthy living. And we really advocate that with our body patients, because we shouldn't just depend on a technology in its own right to deliver the result. We have to put a little bit of work around it too. Let's take it a step further. There was one thing that was missing with the fat reduction technologies. They were excellent, and we had a 100% patient satisfaction with those that we had in the clinic. But if you think what's underneath the fat, we've got muscle. And you and I both know it's all about the core. It's all about the core. And if you actually rebuild one's core, like we see with yoga and Pilates, everyone stands taller, the posture is higher, we become more aligned. And that's what really got me thinking, I wonder what's coming next. And lo and behold, EMSculpt came along. So this was really one of a kind. It's by a company called BTL. BTL has been around for well over 23 years. So if you think of the legacy and the pedigree of the technology, it's nothing new. It had been around, but they just hadn't made it and created it to that level. And what EMSculpt does is it delivers this high-FEM, high-intensity focused electromagnetic wave. So this is another energy wave, and it's delivered to the neuromuscular junction within the muscle group, and it causes it to hypercontract, really causes a strong muscle contraction. We call that supramaximal contraction. What it means is that that muscle contraction is working to 100% of that muscle group. You and I as human beings cannot do that. It's just not possible. At its best, we might contract muscle to up to 30 to 40. At the best, we just can't take it to 100%. So where does this sit within my clinic? It is ideal for everybody. If you think about it, who wouldn't benefit from a better core, a tighter core, post-pregnancy? It's also been clinically proven to reduce the diastasis recti. Do you know what the diastasis recti is?
Yes, I do. It's the two little muscles, essentially. Well, I don't know if it's the muscles, but it's the gap.
It's that little muscle separation that you get between your six-pack muscles, and they very slightly separate due to either pregnancy, so a lot of my female patients, but diastasis recti also can happen in my former bodybuilder patients that weren't using the corsets and the belts when they were really pushing the big weights. So fast forward, let's say 20 to 30 years, those type of bodybuilders who pushing the big weights, they're now in their 50s, they're gentlemen, they've just not had the time to maintain the exercise, the weight, they might have put on weight, and they've got a muscle split, and they've got a bigger gut, and they're not able to do sit-ups and crunches and all of their abdominal exercises because they're now in pain. So what we can actually do with the EMSculpt is with the two probes, we can place it on either side of the six-pack muscle, and you can literally close the gap in the diastasis recti. And we have had phenomenal result in treating these cohort of patients, closing the diastasis recti, and they are aging much more dynamically. They're able to return to their gym exercises, their bodybuilding, and then again, maintenance. With 4 treatments, we do them over a 2-week period, and all we are seeing is muscle strength, muscle activity, and much more healthy patients moving forwards.
I can say personally, having tried the EMSculpt, you can really feel a deeper work on those core muscles. And also, actually, even since having the first couple of treatments with you before we went into lockdown, I suffered from incredibly bad back pain. From pregnancy, actually, and I think it was due to the weakness in my core muscles. I've always had incredibly strong ones being a dancer, and then having done not as much physical activity over the past 10 years and then getting pregnant, it completely destroyed any strength that I had, and therefore then I was feeling so weak that it almost felt like my pelvis was moving out of line, and it was just agony. And since having the treatments, I've actually just realized today, speaking to you, I haven't had any back pain. So that's after 2 treatments. It's had an amazing impact already. So it's a great product. And again, as we've been saying the whole way through this interview, everything has another benefit. It's not just what you initially think that you're going in to have. And I think that's amazing. But leading on to my next question for you, Dr. Sharina, have you seen a dynamic change in this, or a surge possibly, in men coming to see you for aesthetic treatments?
Absolutely, we have. And it's really nice to see that, because if you think about it, men, women, we all share common values, we all share common goals. We want to look, we want to feel better, we want to perform better at home, at the workplace, with our friends, with our loved ones and colleagues. So we're really not that different in what we desire. And when we put it together, the treatments are really not that dissimilar either. So I call them more gender neutral treatments. And it's been great watching male patients either come alone, or they come with their girlfriends or their wives. And sometimes the male patients, they come and they don't want their girlfriends or wives to know, because they want this space for themselves. And that's been really interesting to hear. Also from my EMSculpt male patients, they say, I'm finally doing something for me. So very similar to us women, where we may say, you know, going through what I've done right now, it's taken a lot out of me. I've given myself to my family, I've given myself to my work, I've given myself to my life. And it's great. We do that because we love it. We love to serve with passion. But what about me? We never take the time on ourselves. And I never really hear men saying that. You know, maybe I'm not listening, I'm not sure. But it's been great having our male patients say, this one I'm doing for myself. You know, it's no different to myself going to the gym, taking myself on holiday. I feel great. I feel great when I leave with your practitioner team. I feel great when, you know, I'm much lesser in my frown lines. I feel better at work. I can perform. We have a number of male patients that come to us for underarm sweating. And these are patients who are frontlining, front-facing. They could be presenters, they could be producers, and they're getting so much more anxious about being front stage and sweating unnecessarily, and that could really impact the self-confidence in being able to deliver. So we do a lot of those treatments for male patients. We do a lot of EMSculpt. We do a lot of injectable for male patients, and interestingly, we have a lot of male patients coming with their wives for injectables. They come together. So I'm seeing a lot of shift in more gender neutral treatments coming together, and people coming for their treatments together. And I think now more than ever, when we come out on the other side, I think we're going to see more people wanting to come together. We're going to have to, you know, distance patients in the clinic, but we're going to see much more togetherness, and I hope that we continue to do that. The other thing with male patients is hair. Now, this is a big one. We often want, as girls, to, you know, shed our hair everywhere, but, you know, for the male patients also, they suffer to quite an extent with male pattern balding. And we have a brand new treatment that we launched in the clinic with hydrofacial called the Hydrofacial Keravive for the scalp. It's a fantastic treatment. And for those out there who have had hydrofacial, you know how it feels on the skin. Deep cleanse, the exfoliation, the removal of all the dead skin off your face, the bringing up of the lymphatic circulation, the fresh new oxygen. So guess what? The skin on our face is functioning and behaving and performing normally. You used that word earlier, Joey, how your skin is performing well now from the treatments that you had 6 to 12 weeks ago, but it's still performing now because it's been driven hard by all the topical skincare. Now, same with the skin of the scalp. We do similar steps with the skin of the scalp using the hydrofacial tip, but there's 2 steps. So we deep cleanse and exfoliate, remove all of the dead skin, remove the skincare products, you know, things that have been sitting on the skin, and then we can infuse proteins and peptides and growth factors into the pores that have been cleaned out of the sebums, cleaned out of the debris and the dead skin, and we're infusing it with the right quality products. And we're seeing the results happen fast because there are too many contaminants on the scalp. So I think this is going to be a really interesting one. Hydrofacial launched brand new this year in the clinic. We were the first clinic in the UK to bring this in and work closely with the Hydrofacial UK team. And for those of you interested, look up the scalp treatment. It's still brand new and we get a lot of inquiries about it. So I'm looking forward to when all of this lockdown is raised, to sharing more events with you. We've got a brand new patient education rollout coming up from next week. I really want to speak with you about that, Joey. I think you'd be really interested in more educational events for your audience as well. And but yes, we're going to see an increasing number of male patients coming through for sure.
One thing that I noticed when I came to the aesthetics clinic is it's so discreet, and therefore when you go there you don't feel like you're going to bump into a friend on your way out and you're embarrassed to say what you've been having done. And I think that is another like great factor on why people are changing. And also we say that sometimes the like Instagram or social media world can be negative, but in that kind of way it's had a positive effect, and it's actually made it okay for men to have the same things as women. And I think that it's so nice to see that we're leveling as a generation and population, and everyone feels that we can all do things together rather than it being female or male. So I think it's nice to see that it's going that way. But finally, we've spoken so much about how the beauty industry has evolved so far. Where do you see it going in the future?
Can I just say I love your questions? There's so much to think about and reflect on. And the future is always determined by what we're practicing today, and has always been determined by what we have done in the past. And with that in mind, I would, go to introduce things like where we are right now. And right now, being in the present, everyone is going through a level of anxiety, whether you like it or not. There is a low level anxiety, some more than others globally. And, on that note, there is a lot to be said about everyone in the NHS and the frontliners that are working incredibly hard at this time. So there's a lot of people who are very poorly at the moment as well. We need to really value and think about that. And then there's those of us who are doing the best that we can to sit still, look after our family, loved ones, and friends. But if you take it across the breadth, there is a low level of anxiety throughout all of this. And then we think about facial aesthetics, plastic and reconstructive surgery, facial aesthetics, all of that, beauty. And what is the common theme? Self-care, self-motivation, self-discipline. It's all about looking after oneself. So we are going to see more wellness come into all of these spaces, and it shouldn't be treated independently, whether it's meditation, whether it's massage, whether it's lymphatic drainage. I think all of these things just need to synergize within our practices in some way. I'm not saying we all have to turn into yoga studios in all of our clinics, but just bringing elements of wellness into the practice, whether it's with reception team members, whether it's with our treating practitioners. We bring that into our clinic every day. You've met some of my team, you know how they make you feel, and you know how some of these treatments do. So we bring that into our space. And Francesca Wyatt, whom you've met before as well, she talks very highly. She's very international, and she speaks about wellness in a very positive way within the aesthetic arena. So I do feel you're going to see more of that across the board, not just in clinics like mine, but across the board in many ways, in clinics and hospitals and beyond. IS Clinical in particular, they share a fantastic cancer care program together with some of the local hospitals that they work with in the United States. And so you're really seeing wellness come into oncology centers. And I do feel that we're going to see more of that evolved within our spaces. So I do see wellness playing a very strong part in that. And the future also is in education. Education from the likes of you, the likes of you taking such a strong and dynamic interest into our world, Joey. So thanks again for that, because you've taken a massive interest. This takes a lot of your time. You put in a lot of work on the behind the scenes, on understanding the treatments that you're having on the day. You didn't just come in and say, I'm going to have this and this is lovely. You really went into the depth and the breadth and the science. And I'm pretty sure if I asked you to recite all your all the steps of your treatment, I'm pretty confident you'll be able to do that, because you took a massive interest, and you're interested in the raw detail, and you're willing to learn and put that across to your audience. So you're going to see a lot more education, and you're going to see a much more educated and experienced patient profile coming into play. I'm not saying everyone having treatments, but just being a little bit more informed and educated as they go. And then I think you're going to see, finally, one of my favorite, you're going to see a lot of tech. You're going to see a lot of tech, not just in the clinical space. There is a lot of tech in the clinical space. We're going to see a lot more tech back home. So I'm going to give you a little tip on one of the techs that I have here at home, because I don't have access to my team anymore. So I've grabbed what I could and I've brought it home. And I go to sleep right now with my Deas Pro LED mask on. I believe in light. As you know, I use a lot of light therapy in my clinic, and twice a week here at home, I use my Deas Pro at the end of the day when I'm tired and I'm wired and I need to switch off. And I pop that LED mask on my face, and I know what the light is doing to my skin, from purification, detoxification, and stimulation. And I go to sleep with that, knowing that it's doing me a whole lot of good.
Yeah. I mean, I've seen these actually popping up all over Instagram with various different celebrities. I think Rita Ora just posted an image recently using one, and I am so excited to see the amazing benefits of what you can do at home over the next coming months. And hopefully we'll all get through this feeling a lot better and happier in ourselves. As you say, obviously there's this underlying anxiety, but I feel like if we are focusing on ourselves and looking after ourselves both mentally and physically, and not letting ourselves be overcome by the situation, we will all be able to get through it stronger.
There's no better time to stay connected than now. Yourself, you said earlier how this opportunity has given you an opportunity to connect with more friends, your friends who are living not just locally but beyond, in London and internationally as well. And I'm making the most of this time to connect more than ever. I'm also spending more time connecting with our patients every day, so re-educating as well, and connecting with you, such a great opportunity, and also taking the opportunity to remain positive. You and I both know that the environment that we're currently in now, it's not going to last forever. Things will pass. This pause is temporary, is very necessary, and it's global. So we're all in this together, because your influence influences mine, and so forth. And the faster we remain positive, remain, self-distanced, and remain at home, and also remaining well, it brings more immunity. So when we self-care and when we self-preserve and we remain really positive, it builds our immunity so that when we come out, we will be stronger and better than ever. So I do see more positivity coming into light. I just want to thank you for, really being so positive in our journey as well. And I end on that note to say, when patients come into the clinic, the reason that they get the good results is because they believe in it and they want to. And once you decide that you are going to get a good result, guess what? You will. If you think this isn't going to work and you're thinking negatively, lo and behold, the brain will send the messages to the skin and the rest of the body, and you may not get the result that we're hoping for. So when you think positive, it will be positive.
Thank you, Dr. Sharina. And I must say that coming to the clinic and meeting all the team, you can see that everyone has this incredible understanding and belief in everything that they're doing and offering to your clients. And I think that's one of the main factors that I wanted to share you personally with my audience, because it's not something I feel like is being pushed in anyone's face. I think it's just an amazing opportunity to share your insights.
Thank you. We've always wanted to be a center of education. That was my goal. My goal was to open a clinic similar to how my parents had in Malaysia. I moved to Beaconsfield 6 years ago in 2013. I didn't know anybody. I knew one person, and she's been an absolute dream to have locally. And when we started the clinic, that was the focus. The focus was to deliver amazing results, to help people, to heal people, and with patient education being at the focus of everything that we do. I can't do this alone. I have to work with a fabulous team in what we call a multidisciplinary team approach. And I miss my team, but I know they're okay. I'm looking forward to seeing them on the other side. So everything goes full circle. The key thing is being really true to being patient-centric, and that's with the patient being at the core of what we do, and we've been educated the whole way through. So we work very closely with our product suppliers. I think you've met a number of them, from injectables to lasers to topicals, VISIA and beyond. And they are a very key part in the whole patient education experience. So every year we have a big macro event, and we have lots of little, micro events drip fed throughout. And we get to take that virtually very, very soon. So I'm looking forward to you to being a part of that too.
Well, thank you so much for taking the time to catch up with me today. And I hope and wish you guys the best for the next couple of weeks in lockdown, and I can't wait to see you again soon.
We can't wait to welcome you back again soon, Joey. And in the meantime, thank you so much for taking the time to be with me today. And I want to wish you, your family, your loved ones, and all of your audience good health, stay well, stay fit, and stay healthy.